thinkdisaster.net.
Digestive Simple Disaster Presentation Series. It is a simplified, short, recorded presentation regarding an important issue that help you during your journey for learning disaster. Today we are going to present a very important aspect is a triage. Triage during disaster is different from other triage because disaster is simply that needs is more than the available resource. Because of this unique feature, you need a unique type of triage. Triage means to prioritize victim to groups or categorization according to their severity of injury and available resources. Aim of triage in disaster differ from usual daily work triaging in emergency department, which you need to do the best for all your patient. But in disaster, you need to do good for good number of victims. On scene triage, remember to use safe triage. And in hospital emergency department, remember to use SALT. Adult safe triage is depend on if you are a triage officer. So you ask if any injured patient can walk. If can walk, this is delayed, green color. Priority 3. If not working, if cannot walk, then is he breathing or not? If not breathing, then you apply a simple airway maneuver or adjunct. After the applying of maneuver and adjunct, is the patient breathing? If not, this is black, considered dead. If breathing, then this is considered immediately red. If the patient breathes, then you calculate the respiratory rate of the patient. If the respiratory rate of the patient is less than 10, more than 29, or some textbook they say 30, if yes, this immediately. If it is normal between 10 and 29, then you go for assessment of circulation. Circulation is pulse plus capillary filling time. But usually, because of the time and the number of the victim, they depend on the radial pulse. If the radial pulse palpable and the rate is more than 120, that means this is red immediately. And if is less than 100 palpable and less than 120, it is considered delayed. Second, triage during emergency department during disaster. So adult SOR triage. Depend on 3 physiological categorization: respiratory rate, systolic blood pressure, and GCS of the victim. So each number of respiratory rate, they given a score. At the end, you need to calculate all these score: respiratory rate score and systolic blood pressure score and Glasgow coma scale score. If the score is less than 10, it's considered priority 1 red. So in this situation, we give red 9, red 8 according to score that the patient or the victim get it. If it is 11, that is priority 2. And if the total score is 12, that delay priority 3. These help you to calculate the score in respiratory rate. If the respiratory rate is 10 to 29, it is given a score 4. If it is more than 29 and equal to 29, is given 3. If 6 to 9 is given 2. If 1 to 5 is given 1. If no breathing is 0. Then systolic blood pressure. Systolic blood pressure, if 90 or more, is given 4. If 67 and 89, you given 3. If 50 to 75, you're given 2. If 1 to 49, you're given 1. If irrecordable is 0. GCS 13 to 15 given score 4, 9 to 12 given score 3, 6 to 8 given score 2, 4 to 5 given score 1. If GCS is 3 given score 0. That is all. Thank you a lot.